Paul, I think you touched on this a bit. Frank, you touched on this a little bit from the perspective of societal cost tests, right? Regulatory framework. What needs to change? And are there any other things aside from kind of the, looking forward, be it beneficial electrification, be it feeder constraints in certain areas? Are there other ways to look at low-income programs that can really help their either cost effectiveness or some other way they can really help to drive it forward? So,
Paul, do you want to take that first? Go ahead.
Yeah, I think what you're hitting at, Alex, is right. What is the benefit to the overall grid and maintenance of the grid and management of load that efficiency can bring? And, we have our traditional DSM, right, our demand side load management programs now. Even I'm involved in one where they can shut down my air during really, really hot days and so on and so forth. But again, that's a certain segment of the population who's going to be able to take advantage of that, who even understands what's going on. And I'll tell you a story. Years ago when I lived in Maryland, but in another company's jurisdiction, they had somebody coming every week. They put things in the mail about this program, demand side management program. And then one day somebody showed up at my door, probably after a couple of months of things coming in the mail. And two things occurred to me. First was, why was the company sending me things in the mail when I said, send me my bill, which would be the most important thing you could send me electronically? If I'm saying send me my bill electronically, why are you mailing me anything at all? Because the thing that's most important communication is make sure I get my bill so that I can pay it. But what we found is that when the gentleman came by my house and I answered the door and I said, oh yeah, I'm familiar with your program. You've been sending me mailers. He said, I've been at this 3 hours and you're the first person who knew what I was talking about. Right? So that's about effectiveness of how we're doing our work. But I think if we really want to be able to manage the load on our grid and prevent us from building more stuff, right? Whether that's generation, transmission, distribution, whatever that is, we have to value efficiency as a tool that allows us to do that. And in a regulatory construct, that means that when companies are presenting efficiency programs and maybe have to be a little bit more creative about the types of programs that they present because they want to hit a much larger population, regulators need to look at those programs not just for cost savings and cost effectiveness. They also should be looking like, what does this displace if we're able to have the kind of impact that we want to? And then I would say incentivize companies to do that because what we know in rates, you're going to pay for it one way or the other, right? So we can increase rates by buying more stuff. We can also increase rates by creating a mechanism that encourages people to use less. And I would suggest that the latter is better than the former.
Great.
Yeah, it takes a combination of things to address this. One of the things, Rick, you were talking about how are programs valued. In some jurisdictions now, they are, I think Massachusetts in particular, they are addressing non-energy impacts in their evaluations of programs, and that's really important. And that's we track that very carefully too, because there are all of these ancillary benefits that come from doing this work that would never show up in a utility cost test or a societal test of the classical, nature when you're valuing programs. So, for instance, we've had an ongoing health study for several years now, where before we do any work in the house, we survey all the family members, come back a year later, survey all the family members again. We have a research house in 3 Cubed in Knoxville that's doing this work. We're working with the state of Tennessee Medicare provider, which is TennCare, to understand too what the actual cost impacts are among the families that are receiving Medicaid. So they're also working to do that analysis. We do see improved health outcomes. We see far less thermal stress, far less mental stress, quite honestly, ability to control their utility costs like they've never been able to do before. That means more disposable income for things like medicine and food and clothing and things that these families need. All of that needs to be factored into the value of doing this work. You just can't look at kilowatt hours or therms and say that's it, because there is a much broader impact on the family and on the community through this.
Yeah, Alex, if I could just add something to what Frank is saying, because I think as we think about the future of efficiency and how we're becoming more digitized, this kind of foundational efficiency work is actually, we have to have this done in these households first before we can ever get to demand response, before we can ever get to people really having smart homes and having appliances that can talk to the grid and shed. None of that can happen until the kind of work that the Home Uplift program is doing happens. And so when we think about policy, certainly for us at the Alliance, we're looking at two buckets, right? The first bucket is how do we actually bring equity into the system today? And that means universal access. But then it's also how are we going to maintain that momentum so that we don't create a new divide when we actually have this full transition, because we haven't thought about things like, do we ensure that these communities have access to broadband? Which is going to be increasingly more important on our systems. And so for us, we have to think about where the future is going, but a recognition that we actually don't have baseline for a lot of communities today. And so programs like Uplift and weatherization are important just for baseline,